So we correct the asymmetry. So what we correct is a facial asymmetry here. Now, this is the unique department we started in Continental Hospital. It is going to be the center of excellence for all over the world in correction of facial deformity. We are 3 consultant surgeons with 6 fellows with full support team. We have the experience of performing more than 40,000 surgeries of facial surgeries. So with this experience, I would like to discuss is why this asymmetries. Asymmetries can be because of skeletal, soft tissue, and functional asymmetries together. Now, what are the causes? Causes can be craniostenosis, TMJ sequelae, cleft conditions, hemifacial hyperplasias, hemifacial atrophy, hemifacial microsomia, condylar and hemimandibular hyperplasia, hamartomas, and vascular malformations. Now, why do they happen? Why do this facial deformity, the asymmetry happens? Is because of genetic as a prenatal cause or congenital, or also environmental. Environmental could be trauma, infections, muscle dysfunction, functional deviation, TMJ dearrangements, hemimandibular hypertrophy, and other pathologies. So how do we treat these asymmetries? It can be classified into 2 components of management, that is for growing children and for the adults. In growing children, we give hybrid functional therapy appliances, or we do a procedure called distraction osteogenesis. And we are proud that we are the first people to perform the first distraction of a mandible in 1998. It was invented in 96 in New York by Joseph McCarthy, and 98 we were able to perform it in India, in Hyderabad for first time, in 98. And again, the midfacial distraction was performed for first time in India in 2005, again by us. So we were the pioneers in this. What we do is we open up the jaw, we fix up these screws into the called distractors, and then this is how immediately they look. And every day we make a turn. One turn gives you 1 millimeter. So in a matter of 30 days, we can get 3 centimeters of jaw growth. And then you can see that now the upper lip is come forward. Again, a beautiful looking boy. He has a severe deficiency in the malar area. This area is all pushed backward. So we just push the face, the total face forward, and could create a face. Again, this is another girl where her nose is very badly depressed, her upper jaw is very badly depressed. So we did a nasal, won't eat meat, cannot eat, he cannot chew at all. Again, we did the surgery for him in the upper jaw and the lower jaw, and got all his teeth into normal position, into normal facial contour. This is another girl who had a major fracture of the upper jaw and the orbit. The total eye is smashed out. So the total eye was smashed out. So we had used a lot of reconstructive plates and fixations, and then we could recreate her to a normal looking orbit. The eye which was totally, you can see the eye is totally gone here. Now she can open her eye, she can look normal and everything. This is another person, again because of accident, his again face was fractured. They could not treat it properly, so he has no occlusion, cannot chew it. Now post surgery he gets his normal face and his teeth meets into normal. Now again, but people are born again with something called as hemifacial microsomia. The jaw is not developed. Correction of symptom. This is another young baby. You can see the jaw is not in the upper jaw, because upper jaw was excess. It was very much projected outward and forward. So we opened the upper jaw and also pushed the upper jaw forward. Again, we did the same genioplasty, getting the chin shape. So this is how all the X-rays they look with all the fixation, and you can see how she looks. This is what she was before, and this is normal looking contouring face. The teeth are all gone up, the jaw has come forward, everything looks normal. And this is again one more, his face is twisted to one side. His face is totally twisted. Now you can see how we made it into a normal face, normal looking face. It is all twisted face. You can see the twisting of the face to one side. It's become a normal symmetry. Again, how did we do? Again, distraction. Again, then we plan this on 3-dimensional planning. We have proper AI models. We create a normal model, seeing the exact how much movement of the jaw has to be got. We have proper cutting guides. We use the cutting guides, and then using the cutting guides on the table in the patient as a navigational surgery, we get the total chin forward and position it in normal way. And then by doing that, again, this is another one. You can see the total asymmetry of the face. The face is turned this side. The other side, the child was turned this side. Here, this girl's face is turned to this side again. And this is by doing the same principles of surgery, distraction, mandibular surgery, everything. This is how again we can get how finally she looks now after 1 year. Immediately after surgery and after 1 year, you can see the jaw was so short. Now she has a normal looking, beautiful looking face. So this is making the faces or transforming the faces. This is another patient, you can see again, a total face is twisted. Now after surgery, it becomes normal. So again, where patients' jaw surgeries, where the jaws are placed very much backward because of the deficiency of the bone. So we just pull and get the face forward. Before with the screw, we can stretch the jaw, we can create new bone and new jaws. So again, after doing the second stage, he gets new jaw and a normal face again. This is another child again with the same problem. Again, there is no jaw at all. When there are no jaws, we can recreate the jaws, specific implants. All the deficiency area we have augmented with metals and peak implants, and then we could create a normal face. So this was the amount. And this is hemifacial hypertrophy, where there's a lot of excess fat in the face. So we have to debulk and again contour all the lower jaw, the excess bone. And this is again 6 months post-surgery, how she looks normal. Again, we have a lot of these, what you call as vascular anomalies. These are the excess growth of the blood vessels that happens. What you can see as a hypertrophic capillary malformations, low venous malformations, high flow venous malformations, a lymphatic malformation, and the total lip is eaten away because of this tumor mass. What you call high flow AV for us, because we need to create a blood supply for that thing to grow.
So on that note, 5 to 6 years ago or 3 to 4 years ago in the Netherlands, there was sensational news that printing of the jaw. For the first time, they have done jaw implantation. So how did they do the vascularity in that situation?
Yeah, the 3D printing of the prosthetic jaw, that is what I was trying to, 3D implants. The person who is the father of 3D is called Thomas Moll. He's the professor in Amsterdam and in Nijmegen. And he was one of my co-collaborators. We both have worked right from 2005. And the biggest 3D lab on this earth is from Radboud University. They are the pioneers, and now they are the biggest in AI, in artificial intelligence using 3D models. So, and the person is Thomas Moll. He's a very good friend of mine, and he's visited Hyderabad unbelievable number of times.
So how do you plan to take this? I know you have been so busy, you travel internationally, you operate in different countries of the world, and you have a huge non-profit venture out here in Hyderabad. So how does this skill set of yours should be really percolate across the country, and thousands more should benefit in the coming years? What will be your approach to take this? I know you're a very shy person. You don't want to market yourself. So
I think I should ask two people sitting in the audience to speak about that. One is one of my Indian fellow, and then who has just joined yesterday from me from Nigeria. He is an International Association of Maxillofacial Surgeons fellow who has come. Gurnath Reddy is asking about how do we share our knowledge to all over the world. So I thought you are the best example. You just walked into India in search of knowledge for next 1 year to stay with us.
And such a department does not exist in any of the hospitals in the region. And this is under the stewardship and directorship of a very famous international surgeon. Very proud for him to be an Hyderabadi, Dr. Srinivas Reddy. Dr. Srinivas Reddy has put the specialty of craniofcial surgery on the international map by his phenomenal and astounding work with past saving many thousands of unfortunate children and adults, a lot of congenital and acquired craniofcial deformities with innovative techniques. He's also contributed to the world of craniofcial surgery by his own techniques, which have become today unique practice in the world. ఈ రోజు మాకు ప్రౌడ్ మూమెంట్ గవర్నమెంట్ హాస్పిటల్లో ఈ హాస్పిటల్లో సుమారుగా 50 స్పెషాలిటీస్ ఉన్నాయి. దాంతోపాటు కొత్తగా ఈ స్పెషాలిటీ ఫేషియల్ ఎస్థెటిక్ క్రేనియోఫేషియల్ సర్జరీ ఎస్టాబ్లిష్ చేసినందుకు చైర్మన్ నేను చాలా గౌరవపడుతున్నాను. ఈ వర్క్షాప్ చేసింది ఎందుకంటే ఇక్కడ ఉన్న ప్రజలందరికీ డాక్టర్స్కి ఇంట్రడ్యూస్ చేయడానికి ఈ స్పెషాలిటీ వలన ఈ సర్జరీ వలన ఏ పేషెంట్స్ పిల్లల నుంచి మొదలుకొని పెద్దవారి వరకు వాళ్ళకు పుట్టినప్పటి నుంచి ఈ ఫేషియల్ స్కల్ డిఫార్మిటీస్ ఉన్నప్పటికీ తర్వాత యాక్సిడెంట్ లేకుంటే వేరే విధంగా ఈ డిసీజెస్ వచ్చినప్పటికీ అది ఎలా సాల్వ్ చేయాలి. ఈ సర్జరీ చాలా కాంప్లికేటెడ్ సర్జరీ, అండ్ surgery involves great technical skill. అందరితో చేసే సర్జరీ కాదు ఇది. ఇప్పటికే మేము డాక్టర్ శ్రీనివాస్ రెడ్డి గారు, కోసలా శ్రీనివాస్ రెడ్డి గారు మన హైదరాబాద్లో ఆయన ఒక పెద్ద సంస్థ 25-30 ఏళ్ళ కింద ఏర్పరిచారు. ఎంతోమంది వేలాది మంది చిల్డ్రన్ సర్జరీస్ అని చేశారు. సో ఆయన మా కాంటినెంటల్ హాస్పిటల్స్లో ఇవాళ ఈ డిపార్ట్మెంట్ ఎస్టాబ్లిష్ చేసి దాని డైరెక్టర్గా ఆయన ఈ డిపార్ట్మెంట్ను తీసుకెళ్ళాలి. అండ్ నాట్ ఓన్లీ ఇన్ ఆంధ్రప్రదేశ్ అండ్ తెలంగాణ కాకుండా మన విభిన్న దేశాల నుంచి ఆల్రెడీ హాస్పిటల్లో ఒక నెల నుంచి ఆయన చాలామంది ఇంటర్నేషనల్ పేషెంట్స్కు ఈ సర్జరీ చేసినప్పటికీ వాళ్ళు ఎంతో హ్యాపీనెస్తో ఎన్నో వీడియో రికార్డింగ్స్ వరకు కాంప్లిమెంట్స్ ఇచ్చారు. సో ఆయనకున్న స్కిల్ సెట్స్ రవీంద్రన్ గారు ఆయన సింగపూర్, కౌలాలంపూర్లో కూడా ఆయన ఇంటర్నేషనల్ ఫేమస్ సర్జన్. ఇద్దరు కలిసి కూడా ఈ డిపార్ట్మెంట్లో చాలా ముందుకు తీసుకెళ్తారనేసి ప్రజలకు మనం వాళ్ళు ఎక్కడ బయటకు పోకుండా ఇక్కడనే హైదరాబాద్లోనే కాంటినెంటల్ హాస్పిటల్స్కి వచ్చేసి వాళ్ళ హెల్ప్ పొందగలుగుతారని నేను ఆశిస్తున్నాను.
కన్ఫ్యూజన్తో ఉంటే కాంటినెంటల్ హాస్పిటల్కి వచ్చి ఇక్కడ కన్సల్ట్ చేస్తే వాళ్ళకి అన్నీ కూడా మేము సర్జరీస్ చేసి వాళ్ళ జీవితాన్నంతా కూడా ఒక రూపుదిద్ది ఈ రోజు వాళ్ళు ఎంత హ్యాపీగా ఉన్నారో వాళ్ళ ఓన్ వర్డ్స్లో చెప్తారు. ప్లీజ్ యూ కెన్ ఎక్స్ప్లెయిన్ ఇన్ యువర్ ఓన్ వర్డ్స్ హౌ యూ ఫెల్ట్ అబౌట్.
Hi, my name is Anna.
నా ఫోన్ దించన్నా.
Continental Hospital with my sister. We've been different countries to check her situation, and this hospital was a very good experience we had, especially Dr. Reddy and everybody here. They was welcoming us, and everything was wonderful. And the situation was very good. And I've recommended every patient to come and see Dr. Reddy, and I will appreciate all of you.
The
face, he get to visit on the face, and actually he did their very bad surgery, and he came here and he met very lightly Dr. Reddy. So he did actually diagnostic, and he says he did his fixation on the mouth, and he did actually very beautiful fixation. As you see the patient now, still braces are there, and slowly you will get that, and he will eat his mouth. Okay? Usually he can't eat it actually, it's very difficult to eat. Having two fingers is more difficult, he can't open it. So now he is able to eat juice in his, because of the face is actually closed and his mouth is closed, I mean. He can't able to drink. Maybe within a month he will remove all the braces and he can eat normally. Later on, after doing actually the artificial teeth, no one can recognize him. As you see his face now, his face is perfect as he looks now. So I'm appreciating Dr. Reddy, as well my best friend in here, Dr. Guru Reddy. Actually, I'm really prepared and recommended here to come and take a treatment. They care like a family actually. So I can't explain what they have to do already. So thanks to Dr. Reddy and Dr. Guru. So thank you.